Good evening. Welcome to Women Working for Women, presented by the Brown Women's Network, BWN. We are thrilled to have you with us this evening. As BWN, we are bringing together a community of alumni who are tapping into our shared Brown roots for lifelong social, professional, and intellectual development. I'm Laya Kajavi, class of 1984, and proud parent of a member of the class of 2023. Along with Lauren Zucker, who's not with us tonight, she's class of 91. I'm the co-chair of the Women's Leadership Council, proudly responsible for initiating and managing the BWN initiative. Tonight, we will be hearing from 4 of our Brown alumni who have dedicated their lives to improving the lives of women worldwide in fields including maternal health, human trafficking, education, and community care. You're invited to send the panelists questions throughout the presentation via the Q&A function in the chat box. Moderating tonight's discussion is Women's Leadership Council member Andra Ehrenkrantz, class of 87. She is also a proud parent of a member of class of 2024. Andra is also the co-chair of one of the committees of the Women's Leadership Council, the Regional Events Programming Committee. Andra, welcome to tonight's event, and please introduce yourself and our esteemed panelists to our guests this evening. Thank you.
Hello, everyone, and thank you, Laya. And thank you again to everyone, our panelists, and also our participants for tonight. As Laya mentioned, I'm class of 87 and also the parent of a new current Brown freshman. And the events committee that I'm co-chair of is focused on sponsoring events like this in the digital format. And then we are hoping eventually to get back to in-person events as well, to really better highlight and connect Brown female alum around the country. So keep your eyes peeled for events coming up in the future. And thank you again for being here tonight. I'm very pleased to moderate tonight's event, which is actually our sort of second annual Women Working for Women event. Tonight, we're featuring an impressive panel of 4 alums who have all either founded or work in organizations that are particularly focused on meeting and serving the needs of women across a variety of sectors. I will first moderate a panel discussion with our panelists, but we will make sure at the end that my up-and-coming new co-chair, Fatima Ziai, will also take some Q&A questions from those of you that you put in the chat to go to our panelists as well. So without further ado, I'd like to introduce or have our panelists each introduce themselves, starting with Aleta Margolis. And if you can give your name, where you live, your year at Brown, and your major, and then just a little bit about the organization that you work with and your role there. Thank you, Aleta.
Thanks, Andra. Hi, I'm Aleta Margolis, and I am class of 1989 and parent of a fabulous graduate of the class of 2020, who, as she loves to say, graduated by YouTube today, this spring. I am the founder and executive director of Center for Inspired Teaching here in Washington, D.C., where I live. Inspired Teaching invests in teachers as a leverage point for change in education. And we believe that school should not be a place that prizes compliance, though it has been historically, and it still is. It should be a place that promotes authentic engagement and uplifts not only the voices of children, but the voices of teachers. So what does this have to do with women? Number of things. 66% of teachers worldwide are women. And of course, as you may well know, teaching is considered and has been a women's profession. And so historically, that number is even much, much higher. But today, 66% of teachers worldwide are women. What if women made 66% of the decisions that affect the field of education? Imagine how things might be different or perhaps even better. And going even further, what if women got to control 66% of the funding that goes to education worldwide? So again, this is the kind of change that we hope will happen. And it's the same focus we have in schooling. So often the student is the object or the recipient of an education. You sit passively and absorb. What if the student were the actor, were the expert in the school building? And the same thing actually then happens with teachers. Teachers are expected to follow the curriculum, follow the mandate, sort of do as they're told, and often have very little voice and opportunity to shape their own profession. This is something we're really striving to change because we believe it'll be better for students and better for teachers. And again, this, of course, this applies to teachers and students of all genders, but it's particularly relevant for so many of us who are women in the education field and who perhaps have been socialized to be deferential to other so-called experts. We need to step up and shape our own field. And that's really what Inspired Teaching does with teachers and with students. I'll give you one more sort of specific on how we connect with the work of women and with the panel tonight. We have some core values that guide our organization. And the first one is that we are relentlessly impact driven and nurturing. And it can be very hard to do those two things at once, but we feel passionately that is important. That means our goals are to make sure kids have excellent schools, especially the most vulnerable students. So there's no backing down on that. There's no taking it easy on that goal. But nurturing means if I don't take care of myself, I can't help anybody else. And if I don't support my staff in their own well-being, they're not going to be able to do their jobs very well, particularly around parenthood, which includes motherhood. We center children because children are a critical part of what we're all about as teachers. And so many of my colleagues over the 26 years since I founded Center for Inspired Teaching, many of us have become parents. And kids are, when we used to be at the office in person, kids are at the office, kids are involved in our trainings, kids are part of our experience. My daughter Isabel, who's class of 2020 at Brown, who's on the webinar tonight, can tell you about many times in her childhood when she was hanging out with the teachers at the institutes that we run. And we really make intentional space to incorporate children into our work and our workplace. And it's not easy, and it's sometimes messy and sometimes really challenging, but it's something that I have prioritized for myself and my colleagues. And it has made us better at our work because, of course, we learn from all the students, all the kids around us, whether they're our own children or they are the students that we teach. So I'm looking forward to talking with you more tonight and sharing the virtual stage with my fabulous other panelists.
Thank you so much for kicking us off, Aleta. And I think some of the themes you mentioned of learning to take care of one another and that sense of community, I think are definitely themes we're going to come back to again and again tonight. Now, since Aleta is on the East Coast, we're going to fly it over to the West Coast to Allison, who can hopefully tell us about her work with sort of food, nutrition, and community out there.
Yeah, thank you, Andrea. Wonderful to learn more about your organization, Aleta. Thanks for sharing, and I can't wait to hear from everyone about how our work lifts up women. It's really exciting. I am from the class of 2013, and I live in Oakland, California, from the Bay Area. My major at Brown was Hispanic Studies, and maybe we'll get to how Hispanic Studies turned into working in food and nutrition and food access. But I'm the Director of Development and Communications at 18 Reasons, which is a nonprofit cooking school. So we focus on healthy grocery donations that are paired with healthy cooking classes and nutrition education. So not only getting that emergency food resource out to low-income families facing food insecurity, but also building up their food skills and empowering them to have better food security and better health in the long term, beyond the time when we're giving them that food, so that they can make those decisions for themselves and stretch their food budget further. So our mission is to empower our community with the confidence and creativity needed to buy, cook, and eat good food every day. So we do that through our Cooking Matters program, which I was talking about, where we offer food and also education to go along with it. And one thing I love to highlight, and one of my favorite parts of my job, is that those classes are taught by peer health educators who are former graduates of the Cooking Matters program. So we have peers teaching and leading in their own communities. And that's just so much more effective than someone like me coming in, not being native from the Bay Area. It's really important to have someone who has that lived experience from the same neighborhood, facing the same challenges to healthy eating and feeding a family that our students are also facing. So that's a really important part of how we work with women and uplift women. And so we serve not exclusively women, we serve low-income families. That could be adults, teens, kids, The majority of our students are women. We have 85% of our Cooking Matters participants are women or girls. And our organization is just very women forward. We have a founder and executive director who's a woman, started 18 Reasons when she was 31. And now 18 Reasons has been around for 13 years. And our board are majority women. Our leadership team, which is all of our department heads, we all are all women. And for us, it's really important to have that solidarity with the community and make sure that we are reflective of the people who we are offering services to. So that is just a wonderful part of my job. I love working in that community with my team at 18 Reasons. And I'm inspired by what Aleta shared around core values. I hadn't thought of this until you shared that, but I wanted to share something about our core values. We have several of them. One is liberation. And one of my favorite parts of that core value text is that we explicitly state that we're a feminist and anti-racist organization. And it's really interesting always to challenge ourselves on that intersection. And, you know, the goalpost moves. We want to keep learning and growing, but I think that's something that is really important to our organization and the way that we do our work and approach the communities that we serve. So yeah, I'm excited to tell you guys more, but for now, I'll pass it back to Andra.
Well, fabulous, thank you. And as I said before, I think this community theme, we're gonna see a thread going through, particularly given the challenging times we've all had. We are now we're taking you on a little virtual journey back to DC, to Katherine, who is going to talk to us a little bit about a role she plays in government on the very serious topic of human trafficking.
Thank you, Andra. Hello, everyone. I'm Katherine Chon, class of 2002, and my journey working on human trafficking actually started at Brown on campus. Prior to government, I started a grassroots organization that has now become a global nonprofit on addressing human trafficking and operating the nation's hotline on human trafficking. But it all started up at Brown. We actually incorporated in Providence, Rhode Island on V-Day, Violence Against Women's Day, because we knew that this is an issue that disproportionately impacts women around the world and here in the United States. For those who are unfamiliar with human trafficking, people are forced to work in various industries. Women are disproportionately impacted in domestic work, childcare, agriculture, and other service sectors that are at high risk for trafficking. And then, of course, exploitation through commercial sex and sex trafficking, whether it's online or offline. And these are, we've received cases from all across the country. And in my work at the U.S. Department of Health and Human Services, I'm the founding director of the Office on Trafficking in Persons. While I was at Brown, I never thought I would ever work in federal government. That's why we started this grassroots organization. So it's so interesting for me to be back in this forum and be like, oh, I'm in government now. And what we're doing is really much more at the national and policy level. So we provide grants to local organizations to provide services, housing, tools for economic mobility as they're coming out of their trafficking situations and rebuilding their lives. We're providing significant training for child welfare, social workers, the healthcare sector. Recently, we came out with a whole new set of core competencies around how various parts of the health and public health sectors can improve their responses to human trafficking. And when we're talking about women and their lived experience, one of the areas that I'm most proud of what our office has done is empowering survivors and individuals with lived experience to join us at the policymaking table and inform programming. We fund a human trafficking leadership academy where we bring people with lived experience and allied professionals together to address some of the pressing policy questions that we face as a nation on these issues. And being able to lift up the voices of women, provide those resources, whether it's at that direct service level or providing the space to help shape and lead policy conversations has been a important part of our contribution to this work in supporting women.
Great, thank you. And thank you so much for bringing that other perspective. Our other participants are all leaders or key leaders in nonprofit organizations, but it's very helpful, I think, to have an element to the conversation of how policy interacts with some of those other activities. And both Aleta and Allison talked a lot about the critical role of mothers. Our final panelist, Tara Shirazian, deals particularly with mothers in the area of maternal health. So turn it over to her.
Hello, sorry about that. I'm Tara Shirazian. I am class of 99 and Brown MD class of 2003. I'm an OBGYN here in New York City, and I founded Saving Mothers over a decade ago. So Saving Mothers is committed to ensuring that no woman dies giving life. Our main issue is maternal death and the preventable maternal deaths that occur around the globe every year. We deal with low-cost, high-impact programs that we create. We're a very hands-on group of OBGYNs, MDs, nurses, and other allied health professionals. We create these low-cost, high-impact programs for women in order to decrease maternal death, improve access to reproductive health, and ensure that every woman around the globe, no matter where she lives, is not forgotten in this quest to achieve good health care. And so I'm very passionate about women's health. I believe strongly in the community of women around the world. And as many of the panelists have already mentioned, I see myself as a voice for women, often the voice of women that I feel like in these remote corners of the globe have been forgotten. And we teach and train their local providers. We ensure that every provider around the globe knows what to do in cases of obstetric emergency, in cases where they don't have resources to really take care of women. We develop the kinds of programs that really empower local providers of healthcare to better take care of women around the world. And one of my proud achievements in the last year or so has been lifting some of our global programs and applying them here in New York City to address the racial disparity in maternal health that happens right here at home. And we've learned through our global programs that actually there's a lot of key points and key programs and models that have worked for us in empowering our frontline workers, our birth attendants, our community health workers, the kinds of healthcare providers that live within communities and really can be the voice and also, the programmatic piece for women in those communities. They help negotiate healthcare, if you will. They help serve as advocates. So here in New York, we're creating a New York City program, and it's actually gone really well. And we've been empowering our community health workers here in the city to address issues of racial disparity in health. So we're a very hands-on organization. We believe in creating our programs. We stand by our programs, and we believe that every woman around the world should have access to safe maternal health care, safe reproductive health care, and that as a community of women, we can lift up each other. And I think in the last year, we've learned so much about COVID, which I know you'll get to. So I'm excited to be here. Thank you for having me. Thanks.
Thank you so much. And I love that example of taking sort of a concept that was started in the developing countries and bringing it back to the more westernized, developed communities that need similar services. So it's a great model as well to think about, and for bringing the international perspective to the table too. So in learning about all of your backgrounds and your tremendous organizations, I was struck by both the breadth and just overall impact of all the different things that you all are doing on behalf of women. But as Tara gave me the perfect segue into, it also struck me that each of these areas was probably fundamentally challenged by the world we lived in during the COVID pandemic and are still living through, but hopefully at the tail end of it. So would love to ask each of you maybe the one or two biggest challenges to the work that you do that was caused by COVID. And knowing that Brown grads are definitely out of the box thinkers, helping us understand, like, how did your organization innovate or try to pivot, or what did you try to do to react to that, or solutions that you maybe came up with that might help others who are facing similar kinds of challenges. And I thought, Tara, maybe we'd just start directly with you, since COVID is fundamentally a healthcare challenge to start with, to hear sort of some of your initial thoughts.
I mean, we dealt with every aspect of COVID, whether it be here in New York or around the world. But I think one of the most important pieces was the fear of seeing healthcare providers, the fear of going into health clinics and seeing your doctor, and the amount of education we had to do to encourage women to come in and seek services. I mean, it was even in good times, sometimes it's hard to motivate, women in remote communities to come in and trust their hospitals and trust their health systems. And during COVID, it's 10 times harder. So we started with really empowering the providers around the world who also were very much in fear. Because in many hospitals, we take it for granted here in the United States, but really there aren't the kinds of resources that we have. There are no ICU beds. So if you have patients that are sick enough to require an ICU bed, those patients are not going to make it in most places in the world. So we started by empowering our healthcare providers and our teams, including the frontline workers that I'll mention again, because I think they're so important in this quest to decrease and eliminate maternal death around the world. Those are the birth attendants that go into patients' homes, or the community health workers in the most remote areas that actually go to the home and visit women. So we started by empowering them, by providing COVID kits, by teaching them how to use it, by practicing infection control and mitigating their health risk. So the first place we started was by really empowering our providers, and then by educating our communities and saying, you know what, you are pregnant, you need to come in for healthcare services. It's really important you come to the clinics and hospitals for the deliveries and that you don't deliver at home. We want to avoid and prevent complications, and it is safe. And we do that here in New York. We were doing some of the same things. So there's a lot of commonalities with healthcare, whether it be at home or global. But we were trying to teach our own patients here to come in for care as well. Everyone was very, very afraid.
So it sounds like for your area, it was a lot of empowerment, education, and communication, as opposed to offering different services. It was more those elements trying to kind of help.
The only different services was the resources needed for COVID, which they do not have. I mean, if we think we are lacking in PPE, there's far less PPE around the world. So there are no masks or gloves for that matter, let alone, hand sanitizer. So infection control is probably the largest global issue when it comes to health. So that would be the biggest way that, I would say we pivoted. It was those types of teaching. And actually, we developed all these algorithms. We've published a few of our new algorithms for pictorial algorithms for health workers that work in community, and how they should don and doff PPE, how they should practice infection control before entering the home, what questions they want to ask the patient by phone before approaching the house. And I think a lot of things that we probably will continue to incorporate in services for women. So that was a good, I think that was a good educational process for us.
That's great. I've heard from a lot of nonprofits that I deal with that actually COVID has been a source of innovative practices that a lot of people are continuing. But speaking of resources, I want to throw it over to Allison, maybe, because we've all heard about sort of food insecurity and the lack of availability, and wondered sort of, how that might have impacted your organization and what you guys might have done about that.
Yes, you definitely hit the nail on the head. We have had a hugely increased demand for food distribution, for emergency relief food. There's just so much more food insecurity in our community than there has been in the past. Our local food bank, so we run a very specific type of program where we're offering 20 pounds of healthy groceries per week, but we're also really focused on food skills education. So we can't make the same impact that our local food bank partners make. That's at a much larger scale, but we do something that's a little bit more for the family's longevity and building up their skills. And from the beginning, our food bank partners were just, how can you help us fill in the gaps? They were slammed with so much more demand for food than they had been ready for, because, even though we all started hearing trickles of information about COVID. I think we just were not prepared by the time that everything shut down in California in early March for what was coming next. So that was a huge challenge for us. But I agree with what you said. It was also a source of a lot of innovation, and some of the things that we learned in the past year, we will definitely continue even into, fingers crossed, back to in-person programming and cooking together around a table. We definitely miss that, but we've learned so much and learned how to serve the community better and how to listen to the community better, and how to reach certain segments of the population who are particularly vulnerable, who it would have been hard to reach otherwise, especially during COVID because of fears of contamination and personal contact. So I think the number one innovation we had around increasing our food distribution capacity, we increased our capacity to distribute food by about 300%. So we distributed 3 times as much food in 2020 as we did in 2019. And the way that we did that was largely through partnerships. So we really spent a lot of time in the first weeks before we reopened our in-person Cooking Matters program as an online program, reaching out into our community, to local food businesses, to grocery stores, to our faith-based coalition in San Francisco, to our public school districts, and really trying to pull together different resources that we all had. We all had a different specialty and different access to food to give out. And through that, we were able to really increase our food distribution really quickly. Within probably 4 weeks of that March closure of our programs, our food distribution capacity was up by 300% and stayed that way through the rest of the year. And at the same time, so I work in fundraising and communications at 18 Reasons. So I'm always thinking about our budget. What are we buying? What do we need? What resources do we need? How can we get more donors to support us so we can serve more of the community? And it was incredible to see that even though we had been distributing so much more food in 2020, our food line item budget actually went down because so much of the food we were getting was donated from our local food businesses, which was just incredible to see that kind of rallying together. You're right that food security became just on everyone's mind in a way that it wasn't in 2019. And all of a sudden in 2020, we could all see the writing on the wall, and we saw that this was going to be an emergency situation for our community. Right now, 1 in 4 kids in the Bay Area is living with food insecurity, and 1 in 6 adults is living with food insecurity. That's our community that we serve, the Bay Area. And just in polling our public school Cooking Matters families, who are easiest to reach through polls, through surveys, we saw 75% of these families are losing wages or jobs by May. So within the first 2 months of closure, our families in the Cooking Matters program are really starting to suffer and disproportionately suffer from the economic downturn. So we knew we needed to do something, and we worked so hard to make it happen. My program staff colleagues really saved the day. They just worked so hard to make that happen. It was incredible to see. And then I think another challenge was kind of what you started to talk about, Tara, reaching people around the fear of contamination and being able to continue to reach into new communities and sectors of our population that we want to reach, but who might be hard to reach, especially in the COVID situation. So we have found that by taking our programming online, it's been really interesting to see that there's a few groups that we can now reach that we haven't reached before. And for us, that is people with Alzheimer's and their caregivers. We started a new program called Cooking Matters for Brain Health, because I don't know if you ever heard, sometimes people refer to Alzheimer's as type 3 diabetes. It's very related to diet. And so that's a group that is medically vulnerable, who we wouldn't have been able to teach in person, but by taking it online, they could join, their family members could join, their caretakers could join. And we were able to do this really interesting model where instead of usually we reach people for 6 weeks, we had almost like an infinite model. It was just more about community building and support among those patients and also their caregivers, and really supporting them with those food skills and food distribution. So that was really exciting to see. And the other program that we started was a nourishing care program centered around Black moms. And so we connected with this group. It's called Sister Web. It's a group of doulas who are Black women supporting other Black women through pregnancy and postpartum, and they've been doing amazing work. And so we have this piece that we can fit in, which is nutrition education, food skills education, and food distribution. And so we got to also work with this new segment and this really specific program at this specific time of life that is so important for health education. There's the most open time in your life, we've found, is that when you are becoming a parent for the first time. You're so ready to make those changes for your own diet, for your kids' diet. You really want to see them grow up healthier than you have been in the past. Maybe you're really ready to make changes and figure out how you have enough food to feed them, obviously, but also feed them well and make that healthy home cooking part of your life. So it was a crazy and challenging year. But at the same time, we've gotten to do some things that we hadn't ever done before. And that's been really exciting. I think we'll continue the online programming even once we go back to in-person, just so we can keep reaching people, especially people who have infants who they can't come to an in-person class necessarily. They really are focused on childcare. And so to be able to reach them in their own homes is really important.
That's great. It sounds like you guys were full of innovation. It's so nice to hear, especially like your earlier example of how, again, people bond together. I mean, I've read about a lot of those local community like fridges where people just bring food that's available for whoever needs it, you know. So again, it's nice to see that Americans can bond together, you know, in these times of challenge. And Aleta, probably there's no issue more controversial than school openings and the impact on teachers of COVID around the country. You know, what impact did you see in terms of the services that you all particularly provide on that front?
So there's the sort of in your face, very obvious impact, and then there's a little bit below the surface impact. But the clear at the surface impact, of course, is the stress of immediately back in March, and most places in the country, school immediately started to look just like we are here, except not nearly as neat and organized. It was much more about like, how do I get this thing on? And can you see me? And, you know, right, of course, that was happening for a long time, figuring out how to make school virtual, figuring out how to not only make sure that kids were learning reading and math and science and history and arts, but how to maintain relationships, because at the core of the best schooling experience is meaningful relationships between adults and kids and among kids. And especially for the most vulnerable students, sometimes the teacher is the most important adult in their life, and having that adult suddenly be separated as we all have been for so long was extremely challenging. And so that our focus in our teacher training has always been around relationships and empathy, but we doubled down on that. And then from a logistical perspective, personally, or for our organization, all of our training has always been live and in person. I didn't share my concentration at Brown was theater arts, and our work at Inspired Teaching is based in improvisational theater. We learn to think like improvisational actors. We have good teachers have a clear goal, and they welcome surprise, they welcome input from the students, and they take that input and help them reach the goal. We're gonna learn to multiply fractions, but you know, oh, you want to have a pizza party? Great. You can have a fourth of a third of the pizza. How much pizza do you get, right? So I'm staying with my goal, but I'm incorporating student input. So we marshaled our radical creativity. We switched to online. We've elevated wellness for students and teachers. It's always been part of our work, but it is now a high priority for all the reasons you can imagine. And we have teachers who have had to, you know, go to the chiropractor because they're getting headaches all the time from screen time. We've learned about eye yoga and other things that you do to deal with, navigate screen time to help our teachers address that. We've helped teachers bring physical movement into the virtual classroom. It was something we were doing in the in-person classroom, but we're doing virtually now because it's so very important. That's the kind of on the surface challenges. The underneath the surface challenge that we are also working through with our teachers is, I would frame it as sort of innovation and perseverance on one side, which is fabulous and we believe in it, and the ability to have some agency and sometimes choose to rest on the other side. And so that means, yes, it's a pandemic, crisis and opportunity are interrelated, and you know, let's not waste this great crisis. Let's learn, let's innovate, and that is certainly the message that we have for schools and for teachers. And at the same time, when is it okay as a teacher to say, I just need a break for a minute? Or what if your student says, you know what, I just can't turn in the paper by 11:59 p.m. on Tuesday. I just need a break. How do you balance that accountability with the need to just take a break sometimes? And those are the kinds of conversations that we are pushing for and we think are really important. And as we're returning to actual school buildings. At least here in the DC region and many places on the East Coast, we've been almost entirely virtual, and we're beginning slowly to go back to schools. And in different parts of the country, that's been happening or will happen at different paces. How do we have that conversation about agency? Where do I get to choose as a student or a teacher to say, I'm just going to catch my breath for a minute? And where should I push myself to innovate and to be relentlessly impact driven? It comes back to that relentlessly impact driven and nurturing. So we are finding that balance and deeply engaged in those conversations with our teachers and in the national media and everywhere we can have those conversations.
Well, I think that's fabulous. And I think that combination of the agency as well as that concept of self-care, I think everyone has to have that little moment of like, how do I have some portion of self-care throughout everything that we're all dealing with? So it's great that you're helping to provide that for the teachers, because I can only imagine the stress that they feel, whether they're in school, out of school, doing Zoom, doing both, hybrid, or whatever situation.
Teaching concurrently where you have 15 kids in the room and the other 15 on the screen, and trying to navigate that. It's quite a challenge.
Exactly. And then last but not least, moving to Katherine, and doing a little work looking at your department and sort of what you all have talked about this past year. It struck me that it might not be the first area that people think of, oh, the pandemic is really going to cause challenges in the area of trafficking, but it seems like there's definitely a ripple effect that maybe has been happening. And would love for you to talk about what you guys have seen and what you've tried to impact from your role.
Sure, thank you. It's had a significant impact because individuals who experience trafficking, it's already a hidden population, hard to reach population. And so the common ways of survivors reaching out for help kind of disintegrated. So we would get referrals from the child welfare system, from the education system, from healthcare. And so when a lot of that distancing happened, it also decreased the number of reports. It moved some of the victimization online, online recruitment, online grooming. Younger people are spending time online, and so the age of victimization decreased as well. And in the service provision, with shelter programs, like these are the critical local community services. Yet when this comes from a policy perspective, when local policymakers were making determinations of who is essential, oftentimes these shelter programs were not initially deemed as essential, so they had a hard time getting PPE and just cleaning supplies, hand sanitizers. And I think the biggest innovation for us, there's been some work in the field of doing remote case management and some of the virtual ideas that others have talked about. But the biggest innovation for us is more of a broader awakening to what is considered essential. And whether it's a pandemic or natural disaster, when some type of crisis hits, there was more of an awareness of these essential services of childcare and school and educators, but in the industries that are at high risk for human trafficking, those are often like these hidden essential services, or when everyone in the world was looking or there's increased demand for PPE and rubber gloves and other protective supplies, we were finding that there were people forced to work in factories in Malaysia, for example, to make these rubber gloves or masks or other equipment. And so it just created a degree of transparency to the conditions that people were working and living in, and therefore creating a greater degree of policy response and programming so that those who are often under-recognized in the community are equally protected at work or in their lives and given the resources that they need.
No, and I think that insight, I think, applies to so many different areas. We realize how many different, whether it's, people working to get our food out of the ground, people working in meat processing. Oops, sorry. Actually, it's a good time for me to transfer over to the Q&A part. Sorry, I can't make them quiet. Where Fatih Ziai is going to be my incoming co-chair, and we'll be going into the Q&A from everyone. Sorry if you can't hear me.
Thank you very much, Andra. And I've got a little puppy here too, so maybe he'll join in the chorus and then I'll have to pass on to somebody else. But very many thanks to the panelists. And now we have a couple of questions from the audience. We have, I think, about 15 minutes left. So if those who are our participants tonight would like to ask any questions, please put your questions into the Q&A. And in the meantime, I will start. So I'll ask you to be brief because we have a couple of questions already, and I'd like to give you each a chance to answer each of the questions. So the first one, the participant would like to know how each one of your organizations acts to ensure access and accommodation for trans women and women of color in particular. So maybe we'll go around on that, and then I'll ask one or two other questions. Thanks. I'm going to do it in the order on my screen. So I'll start with Aleta.
Thanks, Fatih. So our core approach to teaching and learning is approach everyone you're teaching, whether you're teaching an adult or a child, with curiosity and empathy, not with assumption. And so our most of the teachers we work with are people of color because we're primarily focused here in Washington, D.C. But of course, we work with all kinds of teachers from representing all genders and many, many backgrounds. And the way that we promote an inclusive environment is this idea that I don't make assumptions about anybody, whether you seem like me or seem different from me. I come to our relationship from a place of curiosity, whether I'm teaching math, how did you solve the math problem? That's so interesting. That's different from the way I solve the math problem. It's not better, it's not worse. I'm curious to learn more because then I can teach you. We also come from a perspective of believing that all of our students and all of our teachers bring something of value. They bring their lived experience to a classroom, to a school, to a teacher training. And in fact, the training doesn't work unless each individual brings their lived experience and their own identity. So that answers maybe not specifically the question, but I hope it addresses it broadly in that we are eager to welcome, and we are eager to welcome everybody, and we actually benefit from the diverse kinds of people who make up our teaching force and who make up our schools. And we work very hard to make sure our teachers are equipped to be welcoming and supportive of all kinds of students in their classrooms, so that the students can feel welcome and comfortable and ready to learn, because there's so much research that shows you can't learn when you're stressed, when you feel unsafe. And so that's a learning goal as well as just an ethical goal for us.
Thank you so much, Aleta. Allison, could you go next?
That's a good question. It's hard to be brief, but I will try. A lot of the same things that Aleta said, we have a very similar aphorism, which is learners are experts in their own lives. So you think about food security, and you can kind of think about it from the portrait. The picture of the food security is about that one person, about that one family, or the landscape view, which is sort of like systemic. These are issues that can be solved through policy, and both are important, but we're focused on the portrait view and working with individual people, individual facilitators, teaching their own community. And so I think it's really important. One thing that struck me about everyone's organization is that we're all empowering the people we serve to lead within their own communities, whether it's survivors making policy, teachers supporting each other, all of these things that we're doing to make sure that the people who we are offering services to are the people who are giving those services, or that the content provider is the same type of person coming from the same background as the people in the class. So that's something we try to work to match as much as possible. And then also just to really listen to people, listen to who they are, listen to what they want, listen to their challenges, listen to issues that they have with others. It often comes up that if there's, identity issues or prejudice among students in the class, it's a great space for difficult conversation. There's nothing like cooking and eating together that brings intimacy and really provides relationship and community with each other. So we do often step in these kind of facilitative roles to help those conversations be safe and productive. And yeah. So yeah, I'll kick it back to you, Fatih.
Thank you so much, Allison. Tara, why don't you go next?
So in dealing with health surrounding pregnancy and reproductive health, we deal with all persons who require those health services specifically. And we're very inclusive of everyone, of, again, all persons who need the type of maternal and gynecologic care that we provide. Specifically to the race question, we actually have a program here in New York City where we focus specifically on Black women in New York, because the rates of maternal death and health disparity facing Black women in this city are 12 times the rate for white women. So maternal mortality statistics are extremely high in the New York City area. And for that reason, that group we have identified as a very particularly vulnerable group. So our New York City program is dedicated exclusively to educating Black women and making sure they have the same type of access to maternal and reproductive health care as white women. And we've actually taken a very critical lens in looking at the programs here in the city, what is provided at the hospitals, what is provided at the clinics. We've partnered with numerous community groups. We have now 5 or 6 partners. It's been really exciting. And, we've learned so much about our community groups and about how well they advocate for women in their communities. So our goal is really just to build bridges to make sure that community groups and voices and advocates in the community are able to get our patients and to get women in the city to the hospitals and the clinics, identify health risks, and get them the kind of care that they need. So it's really about being heard and making sure that communication is appropriate and adequate, and making sure that health risks and complications are well understood by both patients and their frontline healthcare advocates, whether they be community health workers or doulas. So our program deals with really empowering, just like we do globally, empowering our frontline workers and making sure that they best communicate with hospitals and clinics. So we care a lot about marginalized and about healthcare for every person, who needs maternal and gynecologic care.
Thank you, Tara. And next, Katherine. And Katherine, I'm going to start with you on the next question because I think you end up being last every time. So you're going to be first next time. But go ahead.
Sure. So as a federal government agency, there are federal protections in place, anti-discrimination protections on race, ethnicity, gender, sexual orientation. There are executive orders that the Biden-Harris administration issued in the early days of coming into office, challenging the federal government across the board to integrate diversity, equity, inclusion practices, policy making into our programs. Here within the Office on Trafficking in Persons, we've been taking a proactive effort to integrate more than we have in the past anti-racism work within our anti-violence, anti-trafficking work. It all intersects, and so that is reflected increasingly through our programming. But I go back to what I started before of, policies and laws on paper is one thing, but really it's individuals. And so we like bringing people with lived experience disproportionately impacting communities of color in our area and many other social and health issues. Bringing them to the table to inform the policymaking is probably one of the most important things, so that we're not making any major changes without the input of those with lived experience.
Thank you very much. And unfortunately, we're not going to have time, I think, for all the questions, but I'm going to ask this next one, which I think is interesting and it kind of has 2 parts, but a recent grad amongst the participants is asking how, when each of you first graduated from Brown, how did you decide what path you would take? And how have you applied what you concentrated into your real world experience? So maybe you can each take a stab at that question. So Katherine, as threatened, I'm going to start with you and then go in reverse order this time. Go ahead.
Sure. The simple answer. So I started this journey, my journey as an undergraduate student at Brown. And at the time I was like, okay, look, I'm just a student. What am I going to do? This is such an seemingly intractable issue. I'm never going to work in government. But there's this quote that I still live by Teddy Roosevelt. It's like, do what you can with what you have where you are. And it's a mantra for me because as a student, I'm like, okay, what can I do? Like, I can talk to professors. We can learn about this. We can raise more awareness about it. And then with each step, there's like more of the pathway that appears before you. So that's what I would say. And this kind of goes to another question in the chat. The horrific shootings that happened in Atlanta. This was like the start of my journey as an undergraduate at Brown was finding out about Asian women in massage parlors in downtown Providence, Rhode Island, 2 miles from the Brown campus, that were experiencing human trafficking. And I don't know what the situation is, what the work or life situations were of the victims and the families impacted by the Atlanta shootings, but it's just a daily reminder that regardless, we do need strong policies, strong laws, but really it comes down to the human relationships and the community response to get some of these changes. And to the undergraduate student, like, find your community, mobilize your support, and find out what you can do with what you have where you are.
Thank you so much. Tara, please go ahead.
I mean, for me, it was about being in these communities early on. As a medical student, being able to travel and see global health delivery firsthand. And so in kind of being part of work that was done globally, nonprofit work for health globally, I learned that there really was nothing out there at that time, which is now, of course, many years ago, focused on women specifically. So I really felt that my place and my passion is to advocate for women specifically. It's always been about maternal, gynecologic, and reproductive health. It's had a very focused lens on women's health, because I feel like if you broaden the lens too much, the woman is forgotten, the woman is forgotten for the child, the woman is forgotten for the infant, and it becomes about this broader issue of maternal and child health, which I don't agree with. I think maternal health needs its own place and own voice. So I've always been very laser focused, and through the years, people have tried to get me to add other things to our, to our mission and commitment. And I say, no, I am all about women. That's what I do. It's women's health. This is my focus. I don't know anything else. I can't help you with anything else really, but I can really help you with that. So, and that honestly, over time has really helped me hone our programs to make sure that our commitment to women's health is strong and valuable, and we study it, we provide evidence for it, and we make sure that the models we develop for women's health are the best models they can be. And so I would say, when you find your passion, stick to it. Don't let, to that student or the new grad, to that question, stick to it. Your passion will always be heard no matter what it is, and you will have far greater success if you focus in on what resonates with you. So, this is my set of skills. So I feel like it's what I can offer my community and the global community. And so I double down on that. And that's, till forever, that's what I will do. So.
Thank you, Tara. And so I want to give Allison and Aleta a chance to answer. We just have a couple of minutes. So if you could just take a stab at that before we have to close. Thank you.
Okay. Congratulations to the recent grad. I wanted to share that, I think there's a lot of pressure to make things very linear. And I would echo what Tara said, just listen to yourself and your own interests. Think about what you have to give back and what you want to learn. When I was at Brown studying Hispanic studies, I did some work study and also got class credit for volunteering in the public schools doing bilingual teaching. And that just exposed me to a different community. I'm from Southern California, so it was the community of Spanish speakers in Providence. And that really became interesting to me. I loved being able to teach English. That's something I had, but learn about their community. And often we would do food together, because that's my thing. That's how I know how to connect with people. So I learned about the food that they made, and just listen to what is authentically connecting with you, that is driving you toward being able to offer something to other people. That's my best advice, that it doesn't always go from A to B to C. A lot of times you don't know exactly how you're going to get where you end up, but if you just listen to what is authentically telling you that you want to be of service, then you can't go wrong.
Very wise advice. Aleta.
I'll just build very quickly on Allison's point about authenticity and say this. So for 26 years, I've been leading inspired teaching, and a big part of the work of a head of a nonprofit is fundraising. I've had funders challenge me from day one. Why is this important? Why does it matter? Why should we fund it? One of the questions that sticks with me the most was a funder saying, you actually care if kids are happy in school? Like, why, why should we care about that? And the point is, you have to believe in what you're doing, because people are going to ask you about it all the time. They're going to push back. They're going to challenge you. And like the other panelists, my path is different than I had imagined it. And lots of things have changed over time, which is great. But the authenticity of believing that what I do matters, and that learning is the core of solving so many of the problems we've been talking about tonight, is just having an education system that teaches students to use their minds well, as the late, great Ted Sizer from Brown taught me to say. That's what I believe in, and that has kept me going when I've been challenged often by many, many people who are pushing back, is believing that what I'm doing is important. And so I would just underscore that authenticity, and do something you believe is important, because you're going to get plenty of pushback. So at least you should believe it's the right thing, and it'll keep you going.
Thank you very much. A very inspiring note to end on. And I want to really thank our 4 wonderful panelists for taking the time to join the discussion tonight, for the incredible work that you do to support women, and also for taking the time to share it with us. Just before we close, I wanted to mention that the Brown Women's Network will continue to have other opportunities in the coming months to connect with Brown alumni and find out more about what they're doing. There'll be more digital Zooms, our Women's Voice Amplified podcast, and hopefully we'll have some in-person events if the situation allows in the near future. So in the meantime, I hope that I think Megan put into the chat the information if you want to follow us on social media, on Facebook, Instagram, LinkedIn, or Twitter, or whatever your own social media obsession is. If you'll get the information there. And you can follow the Brown Women's Network. And I also just want to highlight, and this is also in the chat, this amazing event that's going to take place on April 27th, another great panel focused on the Biden administration's new gender equity agenda. And it will be moderated by Alex Wagner of the Circus, with a number of class of 87 grads who have had these longstanding careers around women and girls. Pamela Reeves, and also Jen Klein, who was just announced as co-chair of the new White House Gender Policy Council. So it's going to be a really great event, and I hope you can join us for that. And one last thing, there's an evaluation in the chat, and if you could just take just a couple of minutes to fill that in, we'd really, a little survey, we'd really appreciate that. And you'll also get the link by email after the event. So thank you again to our panelists and to all of our participants. We had a huge number. I think some have gone off now, but we had over 100. So it was great having everybody here. Thank you very much, and have a nice evening.